Welcome to the Sultans of Sales podcast. I'm your host, Jameel Pendleton. My friends call me Jay. Today on the show, we've got Phil Louie, orthopedic spine surgeon at Virginia Mason. Dr. Louie has just such a great, unique background. We've never met personally, but that's kind of in 2022. That's fine. We're getting to know one another, in these ways, and look forward to meeting you very, very soon. Thank you, Dr. Louie, for joining. Welcome to the show.
Absolutely. Looking forward to it.
Yeah. Well, so one of the things we were talking about is your background, and because you went to University of Washington or UW for undergrad. You've got just some great names in terms of where you've been in your career. Your residency in orthopedic spine at Rush, and then a fellowship at HSS. So, what have you? Can you talk about a little bit of that, like just your experience in these institutions, and then how is that kind of carried over today at Virginia Mason? Kind of what are some of the things that you're excited about or that you're working on today?
Yeah, no, absolutely. I'm sort of from the Seattle area and always knew that I wanted to come back home just because it's nice to have the family and the community and like my hometown sports teams to cheer for. But I wanted to go out to big cities and then other places to learn, to see sort of what else is out there. Going to Chicago, Rush is incredible. It's a large sort of private academic model. And so we were able to see, be a huge tertiary referral center for a lot of different types of orthopedic pathology. But I got to learn under some giants in spine surgery, and, both from an operative standpoint, a business standpoint, a research and academic standpoint, and sort of patient care with just like the community and athletes and really just everyone. And then going to New York City, further from home and even a bigger city, and more mentors to learn from that have taught me so many different things. And I feel like this one, I'm like a melting pot of everyone who's mentored me in my life. And I get to apply it all at Virginia Mason, where, I'm an orthopedic spine surgeon there and get to focus my entire practice on spine. And I'm probably about, 75, 80% minimally invasive at this point, which is what I had a lot of my training in. But I'm still sort of that old school sort of academician as well, where I love the research and academic side.
I saw that.
So that's a huge part of my practice as well. So there's a huge spine nerd in me.
Hey, but
it's to play around.
But that's great, right? You've seen kind of that private academic, you've seen the big centers, and then now you're focusing the type of practice that you want, but you get to have that research element. I mean, you're the medical director of research and academics for Virginia Mason. And is that always something that you knew you wanted to do, or did you see something kind of during your training that turned that light bulb on in your eyes? Or
yeah, I mean, I remember my mentors always telling me, right, like, you always have to be learning. You always got to find ways to get better, or else you're doing the same thing every single day and all the time. And like, there's very few things in life where you're doing the same thing the same way 1, 2 years, 5 years, 10 years later. And you hear stories of people in surgery doing things like that. And I think for me, it was just being sort of head in with academics. One allows me to do a lot of teaching and training, which I really enjoy. But also it's always sort of just thirst for knowledge and trying to find ways to get better and just learning and being evidence-based in it all. And that way it's like, hey, I've been doing this way, and look, others are doing it other ways. Let's see how they're doing it and how it's going, and let's try it.
And so MIS, so when it's a buzzword, there's a lot of people talk about it, right? I think fewer people are actually doing it. What is MIS spine for you? What does that mean?
Yeah, for me, sort of nuts and bolts, like all my microdiscs and laminectomies are through tube. I do my T-lifts using a tubular retractor. I do a lot of percutaneous screws and indirect decompression when it's indicated. But I'm a big proponent in trying to protect the soft tissues and smaller incisions and getting patients up and moving again as fast as we can.
And is that something in the kind of the greater Seattle area? Is that something that you're seeing your patients are coming to you with kind of those same buzzwords? Like, I want, this, that.
Yeah. I mean, Seattle overall is a very educated population.
Yes.
I mean, it's so tech heavy, and even the engineers are coming in and they're like, oh, we want the minimally invasive surgery. And I'm like, okay, right. What exactly do you mean by that? And they're like, the good one that's small.
Yes.
Gets me going back to what I want to do. And I'm like, All right. Well, that's a good starting point.
That's right. That's right. And that's
So,
it. Yeah. Keep going. Sorry.
no, it's sort of fun to see where they want to take the conversation, but it's a buzzword that everyone knows and wants a part of it.
For sure. And I think it's cool to see, and I started, the minimally invasive spine was there. We had the sextant and kind of some of those things. Some of the tubular stuff was definitely there, but it's completely, it's taken on a whole new, I would say, place now with enabling technology, right? In MIS. And I think that's something that you've seen in your practice as well, probably different through your training, but then now at Virginia Mason. Can you talk about the different technologies and kind of what you like, or I don't know, can we park there for a little bit to talk a little bit about enabling technology in MIS?
Yeah. I mean, if you think about minimally invasive spine surgery, right? Like it's built on technological advances, right? We're trying to accomplish the same goals that the open surgeries have performed over time, but through a much smaller working portal. And so if you think about it, in order to do that safely and effectively and to get better, you need enabling technology to, one, teach people how to do this, convince your hospital administration that the tools you need are actually providing value to the hospital, as well as improving patient outcomes. And I think for me, I had the unique opportunity of really building a spine practice at a surgery center that was affiliated with Virginia Mason that had never done spine surgery before, and really with staff that had never really worked in the spine before. And I remember going there and thinking, all right, yes, I'm a minimally invasive spine surgeon. I'm going to do this through the tube like I've always done. And they're like, well, we don't have a microscope. I'm like, well, that makes my job a little bit harder.
Yes.
And so I bumped into this technology called Vision, is one of these enabling technologies that we use, which allows me to sort of use a camera that's sterile and mounted on the tube, and allows me to basically do all of my minimally invasive surgeries at the surgery center without the microscope being there. And I think when I think about enabling technologies, it serves multiple purposes. One, it allowed my staff to learn what spine surgery was and to learn the steps of the case. And it allowed, from my standpoint, to perform the surgeries that I'm comfortable with in a safe manner at a hospital where I'm not used to working at, and has sort of fewer resources than the downtown, big campus would.
Sure. Yeah, no, I certainly appreciate that. And it's been cool to see kind of, I remember your post on LinkedIn not long ago was a PTP case where you're showing the workflow. And, I think for those that watch this, that don't truly understand, I mean, that's a relatively new twist on the lateral access procedure, and it's an evolution of it for a lot of reasons. Can you talk about it? Can you talk about your thoughts on lateral surgery, or just?
Yeah, absolutely. I'm a huge proponent of single position surgery. So, I mean, I think before the onset of PTP and the prone lateral sort of surge, I was doing single position lateral surgery where my body sort of contorted into awkward positions, as I'm sure you've seen as well. And being in a prone position seemed to be the next advancement, and the next sort of step for that. And, being a research and academics focused guy, I could see that the evidence was starting to build on the safety profile and the benefits of that procedure. And I remember I've done these first few cases with my partner, Venu Namani at Virginia Mason, and we do these together. It's a lot of fun to operate with your colleagues, by the way.
Yeah.
And
I'm sure.
I'm young. I feel like I'm fairly physically fit, but I found my shoulders being like so fatigued during those cases, because I'd be working up here and trying to peer into that small space.
Right.
And we were thinking, well, there's got to be a better option here. And so, yeah, we've been able to use the camera both in the PTP and prone lateral cases. So now sort of I'm working down here in a more comfortable and less fatiguing position, and being able to kind of keep my neck looking forward. I've got this huge fear of like one day having to be my own patient, because I'm always looking down into a wound. So anytime I can keep my neck straight looking ahead, I'm all for that.
Well, I mean, I think that's a real fear. I've heard multiple surgeons tell me that. I did a lot of laterals over my course of my career, and just kind of that peering down all day long. I mean, just for multiple cases, multiple days, weeks, months, all that over the course of your career. I mean, that's definitely something that could have an impact. And I don't know, I've never, outside of a cadaver or in a different foreign country, I've never done anything close to to what you all do, and or have I guess the firm understanding of the liability behind it. So trying out new things has its element of risks, right? And to your point though, teaching is it and the learning curve, I would say, of these new techniques is a big hurdle, right? So it's cool to see there's some cool technologies, right? Navigation, robotics, right? Visualization, which is what Vision represents, to help you all in just further advance spine surgery. It's noble cause.
And it's a lot of fun too. So
how so?
It's I mean, right? Like people always talk in psychology about having this growth mindset, right? You don't want to be stuck in your own ways. And I think it's good to be humbled to a certain extent. And it forces you to sort of be more prepared and to focus better. And
yes,
it's just fun to keep pushing forward.
No, absolutely. I mean, I'm literally experiencing that today, right? I went from two pretty big spine companies, large companies, to a very small one. And there's always going to be learning opportunities everywhere we go, but this one's like getting out of that comfort zone or kind of the familiar and putting yourself into the areas where growth is the only way. You're either gonna fade or you're going to grow and advance. And I think it's good for as you said, the spirit or the psychology. Maybe that's something that I always liked about athletics. And you mentioned athletics, and I see behind you got some stuff like, can we pivot completely? Cause I am a sports junkie. I love all the sports. I've played quite a few of them as well. So let's talk about kind of Phil Louie and kind of like what you like about sports, or what are your teams? And
let's
go there.
I grew up playing a lot of sports. I love sports and sort of how it's related to surgery as well. We're actually working on a textbook right now, and part of it's in terms of surgical training and medical training, where you take the aspects of musician and athletic training and you apply it to sort of learning in medicine as well.
Wow.
And I remember being in Chicago and the East Coast, New York City, and I'm a huge Seattle sports fan. I'm still crying over the loss of the Sonics 20 years ago.
Oh my gosh.
Where it hurts to watch the NBA still. And I could not, the Mariners and the Seahawks, the Monday night games are starting at like 8:30 p.m. And the Mariners were playing at like 10 p.m. And I was like, look, I just got to get back home to watch my teams as if I'm really changing the outcome. But I collect a lot of sports memorabilia. My grandpa and my dad got me really into it at a young age. And so we just it's like a Seattle sports sort of shrine we've created in our homes because it's fun. It keeps me feeling like a kid when I come home and relaxing. So
absolutely, man. I think it's part, the nostalgia of sports, right? I mean, admittedly, I'm a Cowboys fan, so I know that our best days are behind us. It's torturous. But I'm looking over there to a Cowboys football that has all their championships, and it's signed by the big three. When I was a kid, we were winning Super Bowls. Like we won 3 of them, and I was like, oh, this is awesome. This is how it is. And it's been a long journey since that point, but it definitely takes you back to those days when you really caught that bug of why sports are so incredible. And it's cool, man.
It's fun, and it gives me something to do and pass on to my kids. It's just fun to talk to my dad about all those things too. So
totally.
I get it. It's I ride the roller coaster, and my favorite line is "There's always next year." And
yes,
here we go again.
Yeah, I mean, there always is next year. I mean, the Cowboys. I mean, I don't want to make this about the Cowboys, but it's every year. Everybody's, this is our year. And it never is. Never. I want to stop saying
You're Troy Aikman, Emmitt Smith, Michael Irvin days are
they're long gone. They're long gone. So okay, there's a couple of, so we'll pivot back into a couple of things. Like we were talking offline, and some of the things that would make this episode a good one about ASC. You mentioned that, and I think that's really neat. And maybe we could further expand on what you've learned, or kind of where you see that going. But also I wanted to talk about balancing your life, like kind of on an interpersonal level, because like not all the people that watch this are going to even know about what spine surgery is. And I think a lot of them do, but I think a lot of it's applicable for what you're doing, setting goals, or how you go about structuring, like how you build mindset that's kind of the stuff. I was a psychology minor, so I geek out on that, these topics. But I'd just love to just have a discussion about like what do you draw from, or maybe some of the things that you use today that you could share with us.
Yeah. I mean, I think for me, finding that balance is really important. Like I know deep down, I am a huge workaholic. Like I carry my cell phone everywhere I go. My colleagues make fun of me because that 8 to 10 p.m. hours, like my power hour of emails and getting work done. But
Yes,
it's nice for me because like, I wake up every morning at 5 a.m. and I have to get a workout in because it's like the one time of the day I get to myself with no
that's
kids
it.
running at me, no patients, no colleagues. And I enjoy those interactions, but being able to just sort of like clear my mind and get some endorphins running is nice. And, I just sort of built a home gym at home because I didn't want to waste the commute time going back and forth because, I work a long time. I don't get to see my kids all
That's
that
right.
much during the day. So now if I work out at home, I can make breakfast and see my kids every morning before I head out. And I think that
It's great.
sort of brings a lot of joy for me. And just like, I want them to see someone who, one, is committed to their mother and always
Yes.
trying to hang out and help out around the house. And she works a full-time job too, but also that, hey, look, I can work really, really hard and find time for myself and always be there for them too. So I wake up and I draw a little picture for them every morning on a napkin and set it next to their breakfast tables. And so they're always getting at least different sides of me. And so at least can be an example for them is really important.
That's so great. It's so powerful too, as a father to them, the example that you're setting. I mean, we share that. We share the early morning kind of wake up with intention and kind of, I always like to just do something challenging to start my day because the rest of the day is a little bit less, maybe stress. It's a different type of stress.
Different stress. Yeah.
Yeah. I would say it, but that's awesome too about your kids with the breakfast. I mean, those are those moments. I mean, we've talked about I've talked about this and I read about this a lot. Like time is the most important thing. It's the most valuable thing. And you don't get it back. I mean, they're that age one time.
Yeah.
And you being there for them, you're also showing them kind of like, here's what dad's doing, right? You work hard and you also take time and make time for physical health, for the exercise, which I think critical and has carryover to mental and
absolutely.
all those things, but also just family time, just being there. And you can't replace that. So I'm really glad you share that. So that's really, really neat. Okay. So let's talk if you still got some time. I'm going to check the clock and make sure you're good. But I wanted to talk about streamed. I saw that I was researching a little bit. Can you kind of share what first off introduce to the audience what it is, and then really just kind of like where that all started, because I think it's fascinating.
Yeah, and really to give kudos where kudos are earned. It's really a team effort that was here. Kevin Campbell and Christy Diamond are two of the co-founders that I've worked with. Kevin was a co-resident of mine, and it really was his brainchild. I remember when his mom was going through a foot procedure, and he kept calling him with simple questions about like, what do I do this? And why am I doing that? Or when do I do this? And he kept thinking, and I kept thinking, I mean, it's on your instruction sheet they gave you. Or we would take call as residents and it'd be the same patients, or I don't know, there'd be different patients always calling about the same question. And it's like, well, we talked about it. I know we talked about it, one, because I was in the room. And two, by the way, didn't you get these piles of paperwork afterwards? Like they're all listed on there. And then it occurred to us, you know what, there's got to be a better delivery system for information. And there's got to be a better way to engage patients before and after surgery, because they're getting irritated and frustrated by things that we aren't even recognizing, And so we thought, well, how can we best do that? And we're like, well, we're in a tech savvy world, we're sort of millennials. So, patient engagement and mobile health and the next app are always on our minds. And we thought, well, you know what? If we think about our family members who go through the most problems, or our patients who are going through surgery, they're not like the heaviest app users in the world either, right? You have to download an app, you have to update it, you have to remember login information. Now, I can barely do that from time to time. So like, well, let's go to text messaging. Most people can figure that out. You can figure out how to get yourself in the door to a hospital for surgery. You know how to read a text message, no matter what type of phone you have. So
that's right.
we designed programs on text messages initially
Mm-hmm.
that would basically take all of the instructions from our attendings, and we would just put them in text messages that were being delivered at the time that they were supposed to be provided, where it made the most sense. And we started this in hip and knee replacements because
Mm-hmm.
those are sort of the most reproducible procedures with similar patient populations. And it's grown now to become sort of a unidirectional chatbot.
It's great.
Where patients can respond with questions and keywords, and we've built in responses to those questions based on the surgeon's preferences and what they've looked at and responding to them. And we've provided videos from the team encouraging them and cheering them on, giving them platforms to share their inspirations, and then seeing patients' inspirations that have gone through similar procedures at different time points along the way. And so it's now sort of a prior to surgery, and then for anywhere between 4 to 6 weeks after surgery, where they're on this sort of chatbot text message program.
That's incredible. I mean, I think that's going to have, I mean, you tell me, but I would imagine it's going to have ramifications beyond, because a lot of surgery is the expectation management, right? And then post-operative care, and then patient reported outcomes. A lot of these things that we're starting to see, a lot of it is just clarity, and this provides that kind of on demand or whenever they need it. That's a great. I think it's conceptually it's great. It's awesome to see. It's starting to get some legs. I mean, that's
and it's wonderful. A lot of fun to see how it's grown and how people have sort of adapted it too. And then, remember, I'm an absolute nerd, and research is important. And I was like, look, we don't want to just create a product and tell everyone it works. We actually did a randomized controlled prospective trial on it. And it was actually published in the Journal of Bone and Joint Surgery, 3 or 4 years ago. So we have sort of the peer-reviewed sort of study that supports this type of service that we provide. And it's not just a streamed service, but it's the whole field in general, where I think figuring out how we can engage our patients is becoming more important, because we can perform surgery the same way every single time. And yet we've noticed that patients recover very differently from each other. And so how do we reach out and provide sort of this personalized care to a patient, outside of the operating room? And this is the world that needs to grow.
Yeah. And, personalized care is everything. I mean, I think people in general just want to be heard. They want to have, their questions answered. And, sometimes you can answer those questions on the front end, or you can anticipate based on your research and the modeling of, well, here's all the different things that may happen. Here's all the information that we need. And then I'm sure even then it's a constant evolution as the procedures, the technologies, and, change. You're going to have to, I would imagine, adopt and tweak things along the way.
Yeah. And, big data is like a big term now as well, right? And using machine learning and artificial intelligence, and taking all this database sort of information that we've gathered over these years, and trying to apply it to, how can we do better? But I think the one thing we need to remember, that at the end of the day, the person sitting across from us it's another human being, right? It's someone's friend, it's someone's husband, wife, mother, father, brother, sister. And so how do we take this information and still provide them with the care that they need, not the thousands of people who've sort of sat in that chair before?
That's right.
And what can we do to make them feel like, they're going through a process where everyone's caring for them? Because that's what every patient ultimately needs, more so than a microdiscectomy or a laminectomy or fusion. So
yeah, just they need to improve. They got pain. Yeah. They want to get rid of that pain and just get back to their lives or improve their lives. And yeah, you're 100% right. Okay, so couple more. I always like this couple different these types of questions. What's the future of spine surgery? Like, where do you see this going? And kind of and nobody has a crystal ball, but I mean, you've got a ton of experience, and you also have a lot of runway left. Where do you see, like, what are you going to be doing in 5 years? Like, what does surgery look like for you?
Yeah, I think it's a very fun time to think about that question, because there's so much going on, right? There's robotics, there's navigation, there's all these enabling technologies. People are starting to really look at data more carefully in terms of like patient demographics and outcomes. I think at the very end of the day, what we're going towards is trying to find this integrated platform that takes a patient from the preoperative assessment all the way to 1 or 2 years out from surgery. And what we talk about in navigation and robotics and augmented reality, virtual reality, those are not the ends. Like those are means to sort of this integrated end platform that are all pieces of this larger puzzle. And yes, those are the tools we talk about the most, and that's the surgical element. But how can we take the data that those instruments are gathering and use it to say, okay, our goal for surgery was this. This is what we actually achieved. Did we achieve it, and how did we do it, or where did we fall short? And then taking that information back into this whole integrated platform. So when the next patient comes in, okay, they're presenting with this type of pathology.
That's right.
What do we need to do to get them from A to B in a safe manner? And then convincing, our hospital administrators, or we are in a healthcare landscape that is really cost constrained, right? So we need to show that there's value in the work that we're doing and the equipment that we're choosing. And I think that's where the research side comes in, is that, just because it's fancy and new and has promises doesn't mean it's going to deliver on all of those aspects. So I think there needs to be rigorous efforts in sort of defining, okay, here's the next set of technology, here's the goal. Let's make sure that we can make this reproducible. And how do we get this out to everyone?
That's what's interesting. It's just so well said. And I completely agree with you. That's where things are going. But I mean, if you ask 10 spine surgeons, if you show them films and pathology, you know where I'm going. You're going to get, 15 different possible procedures. How do you standardize care or make it where you can utilize data and to improve that global care when you still have such a disparaging, Cheesecake Factory menu of options of what you could need? Like, it's just such a difficult for me to wrap my head around. I mean, but I'd love to hear your perspective on that.
Yeah, that is a really good question, and one I actually just love thinking about. And sort of where I've settled down is sort of this and that, like that's part of the art of spine surgery, right? Like being able to see a canvas and being able to paint it in a lot of different ways to achieve whatever outcome is best, right? And it's based on what equipment you have, the type of training you've undergone, your partners and what they're comfortable with helping you with. But I think at the end of the day, like there has to be some sort of standardization, right? In order to drive costs down, in order to drive sort of better outcomes. I mean, at Virginia Mason, we have this whole system of the production system that's based off of Toyota's production system and lean methodology. And, if we think about those types of systems and life in general, I think there's areas of variability in life that are necessary, right? And then there's areas of variability where there's a lot of waste that can undergo continued improvement to get better. And in my mind, you know what? There's a lot of ways to successfully fix a spine.
Yes.
And maybe that's the variability in our practices that is necessary. But the things that we can standardize are, all right, what do we do in the recovery area? How do we, help them post-operatively?
Right. Can
we give them the support that they need and standardize that type of post-operative care as well as the pre-operative workup? Do they go through some sort of multidisciplinary sort of gatekeeper or a review process so there's no unnecessary surgeries? How can we improve the indications? And with that being said, it's the whole episode of care, and there's elements of variability that I think will always be there, and that's okay. Yeah.
It sounds like that's a passion of yours. I mean, obviously the research, but taking it a step further, I mean, you're very intentional about what you do. You MIS, and it's not easy. Minimally invasive surgery is more difficult for the surgeon. It's better for the patient, more difficult for the surgeon. Many other people a lot much smarter than me have said that. I'm just saying. It sounds like that this is a as you said, a really exciting time in our industry, because it's the technology is growing and growing pretty rapidly. The training, and there's still a lot of different ways. The variability, as you said, of the approaches to how you treat patients, it is going to be different based on all the variables that you mentioned. And but I think minimally invasive surgery with some of the enabling technologies does allow for some bit of repeat standardization or just because of the tools that we have in the research part of that. So yeah, I don't know. It wasn't really a question. I just,
yeah, no, it's sort of the world we live in, and it's fun because we're not trying to get everyone to do things the exact same way. It's quite the opposite, right? We want people to do things in what they feel is best. But I think the way that we get there and the way that we describe it and the way that we sort of provide evidence for it should be standardized.
I love that. Well, I would certainly agree. And it's exciting to hear, from your perspective, all the things that you're doing today to treat your patients in the market that you're in, but also just, I would say for care, for global care in terms of what you guys are working on at Streamed, in terms of the research that you do and your partners are doing. It's just super awesome to be connected with you. And I'm grateful for our time today.
Yeah.
Is there anything, I always like kind of, if we have time to kick this back to you, is there anything you wanted to share or ask or just give you the floor?
No, I mean, I really enjoy what I do, and I thank you for sort of bringing me onto this. It's always fun to talk about this and sort of dive into a lot of the different tangents along the way. I think it's important, as you've had a chance to speak with a lot of my colleagues as well, that the community that we work in is really important, right?
That's right.
At the end of the day, it's easy to sort of do your own thing and feel like you're in a silo.
Mm-hmm.
And it's hard, right? The complications feel worse. The joys aren't as celebrated. And I think it's really important to sort of find that community that you can work in and find people that you can really trust and then dive in with, because at the end of the day, we're all going through the same thing, and it takes a little bit of vulnerability to get there. But the community aspect and what you do and what I do and how our worlds come together, I think is really important moving forward.
Well, thanks for saying that. I mean, this is a passion project of mine, right? I love my conversations. I always have with surgeons. There are always those that I come away from a conversation like this. You've been gracious enough with your time. We've got 45 minutes, right, of a great conversation where I've taken some notes and just learned so much. And I always thought, like, well, I wish I would have recorded that, like to either go back on that or to share that at scale. And so that's the podcast. That's why I started this thing. And it's awesome that we can share this conversation. And maybe somebody out there, is going to be a better dad for that little, glimpse that you shared of what life is like at the Louie house. And, that's just so cool. Or a young surgeon or aspiring surgeon or a med salesperson that just kind of going through some tough times or struggling. It's like, look, we all go through tough times, all of us. And you just got to get up, you just got to keep that mindset, that positivity. So
absolutely.
Well, this was fun, man. We'll have to, I can't wait to meet you in person. And thanks for coming on to the Sultans of Sales podcast. Tune in next week.